Hi, Dr. Hagmeyer here, and I wanted to shoot this quick video on gluten and gluten sensitivities. Now, if you're new to gluten, let me quickly say that gluten is this glue-like structure that really gives bread the dough and its elasticity that we know it for. However, it's really important to understand and realize that gluten is found in all grains, including oats. That means that every grass-bearing seed contains gluten components. I'm going to say that again. Every grass-bearing seed. So if it comes from a grass-bearing seed, it contains gluten, okay? Very, very important distinction that you need to be aware about. Now, depending on an individual, certain individuals can be more sensitive or less sensitive to different components of gluten, okay? The different proteins that are found in these grains. Gluten-free diets are quite in vogue right now. Many celebrities are pushing gluten-free diets. Sports teams are advocating gluten-free diets, very similar to the way diets in the past, like Atkins and South Beach, Eat Right for Your Blood Type, were all popular many, many years ago. My biggest fear, however, is that many people think that a gluten-free diet is just another fad diet, and it's just something that you can do because it's good for you. And like the South Beach diet, like the Atkins, and like many of these other diets, you're allowed a cheat day while being on a gluten-free diet. And this is a huge, huge problem. This is a major problem that I see for many people. It's a problem that's causing debilitating diseases to get worse. It's causing massive confusion because people go on a gluten-free diet, they expose their body to a cheat day, so to speak, and then they wonder why they're a couple days later, maybe a month later, they're feeling a whole lot worse. Let me say that every patient who comes to our office and comes to the Institute here that has a chronic condition, and when I say chronic, I mean things like fibromyalgia, thyroid disease, diabetes, rheumatoid arthritis, autoimmune, MS, cancer, Parkinson's, lupus, IBS, and the list really could go on, believe it or not. Every single one of those patients who comes to our office where we're treating them metabolically is tested for gluten and cross-reactive gluten epitopes or gluten proteins. I want to spend a few minutes discussing this problem that the ingestion of gluten can cause. The second reason I wanted to shoot this video was I want you to understand how serious a gluten sensitivity really is. And the last reason I wanted to put this video together is that there are tons of websites that have just inaccurate information about gluten and then offer food recipes to people that unknowingly have gluten sensitivity or have a gluten cross-reactive sensitivity, and this is making many, many people very, very sick. So I got an email from a lady who's been on a so-called gluten-free diet for about 6 months and hasn't noticed much of a change, and she said, "Come on, Dr. Hagmeyer, can't I just cheat a little bit? I've been doing really good in cutting back the gluten." And here's what I want you to realize is that every time you think about just having one little bite, I want you to realize that you can pretty much guarantee that any progress that you've made will be set back by 3 to 6 months, depending on just how bad the integrity of your immune system and how bad a leaky gut may be existing in your body. Now, when it comes to gluten, that's how serious this is. Okay, this is one of the major reasons why certain individuals will go on a gluten-free diet. They don't stick to it 100%, and then they say a gluten-free diet didn't help them or didn't work. And I want you to think about this scenario for just one little minute. All right, you knowingly just ate a piece of cake, maybe a half a slice of bread, maybe 1 or 2 crackers with your New England clam chowder, and you rationalize, well, it's only one little piece, or I'm at a party, it's my birthday, it's my kid's birthday, I'll get back on track tomorrow and I'll be good tomorrow. Well, unfortunately, it doesn't work like that. Within a couple of hours and sometimes a week or 2 weeks later, your body is going to tell you that you just blew it, okay? You begin to experience a cramping sensation. Maybe you experience painful diarrhea. Maybe you experience constipation. Or maybe a few days later, your joints in your hands, in your wrists, your shoulder, your back begin to feel real achy again and swollen. Perhaps you start to have an increase in the frequency of headaches and migraines that had disappeared. Maybe you start experiencing dizzy spells, or you start to experience brain fog, or maybe potentially your MS flares up. These are just a couple quick examples, but I could spend about an hour going through all of the possible scenarios, but I think you get the idea. Now, before you reach for that slice of bread, those crackers, or that beer, I want you to remember that even a small portion of gluten can cause chronic inflammation in your body for up to 6 months. So each of these symptoms that you just experienced is really a response that indicates that your immune system has just been activated and you're having an inflammatory response. And more importantly, each of these symptoms is more significant to your overall health than you may realize. Okay, we know that when your body activates these inflammatory pathways, it's going to have a profound impact on your endocrine system, which is basically your hormones. It's also going to have a major impact on the neurological system. It's also going to have an impact on your gastrointestinal system. And after a couple of days or maybe a couple of weeks, the outward manifestations of that cake, the crackers, or the beer that you just ingested will eventually disappear. Everything seems like it's back to normal. Well, guess what? Inside your body, it's not. Studies have actually shown that the smallest amount of gluten, say a cracker, a cracker the size of 1/8 of your thumbnail, or the host potentially at church, will have a prolonged inflammatory effect in the body for up to 6 months after the ingestion of it, if you're gluten sensitive. So I'll say that again in case you missed it. A cracker 1/8 the size of your thumbnail can wreak inflammatory havoc in your body for up to 6 months. And so not only do studies show that it's a black and white issue, but so does my clinical experience in working with patients for over 15 years. There is no in between when you have a gluten sensitivity. It's either all or none. If you pick an occasional crouton from your spouse's salad or ingest some hidden gluten in a certain processed food that you may not be aware that gluten is hiding in, and you've just excited your system potentially for another 6 months, this again could explain why you feel the way that you do. So if you've been pretty good, at following a gluten-free diet for several months, and you wonder why you're still having symptoms, this may be the explanation. Sometimes it's a difference between a person experiencing 10% improvement, or 50% improvement, or 80% improvement. It doesn't have to be the cake. It may be that glass of beer that you had at the dinner party with friends. Maybe it's the vinegar dressing on your salad. Maybe it's the chewing gum. Maybe it's some other gluten-reacting food like dairy, soy, corn, milk, eggs. Maybe it's in that gluten-free food that you've been purchasing, found in the gluten-free aisle where there's sorghum or tapioca or buckwheat or amaranth or rice that your body's reacting to, okay? This is where specialized testing, like the kind that we use in our office, can be extremely helpful in working with patients that have chronic health problems. So again, any food that elicits an inflammatory response from the body needs to be on your list of foods to avoid. Some of the foods need to be avoided forever, like in the case of gluten. Other foods, called cross-reactive foods, may just be a temporary elimination. And we did a whole video on an elimination and what's the best way to reintroduce these foods. I won't get into too much of that right now, but I do believe it's so important to work with a doctor who's familiar with this specialized testing, someone that can guide you and identify the kinds of problems, but also someone who can work with you and has the experience of working and reintegrating these foods back in your diet. For those of you who are already patients in my clinic, I just want to this video to serve as an important reminder. If we discuss with you foods that you can eat and foods that you can't eat, you need to follow that so we can dampen down the immune response's attack on your body. Again, I'm Dr. Hagmeyer. I hope you enjoyed my video. For more information on gluten testing, gluten-free recipes, or you're just looking for more information about our practice, you can check out my website at www.drhagmeyer.com. And as always, if you found this video helpful, please share this with others. It's the difference between someone going on and suffering and wandering around going from doctor to doctor to doctor, or someone getting their life back and having a clearer path to better health. Again, I'm Dr. Hagmeyer. Take care.